Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and today we're going to talk about another topic in this series on botched plastic surgery, and today we're going to talk about patient factors. So how do you, the patient, decrease the risk of having what might be conceived or considered a botched plastic surgery? How do you decrease the risk of having an outcome that you're not going to be happy with? And I'm going to look down at my notes from time to time because I want to make sure I cover the important things. Most of it I have in my head because we do this day in and day out with our patients, but I just want to make sure that we've got it all. Certainly you want to be in as good of health as you possibly can be. Your weight and your BMI need to be well controlled, and there are certain thresholds for different surgeons to do different procedures. Generally speaking, when your BMI is above 35 and certainly above 37, the risks of complications are going to go up, and they're going to go up pretty dramatically. And it's just something to pay attention to. Health factors, diabetes, high blood pressure, anemia. We want to make sure all of those things are corrected and maximized for the benefit of your surgery and your outcome. What are your expectations of the surgery? I will often ask my patients to go online and through this fabulous World Wide Web, Google, naked pictures of the body part or body area following a surgery of what they're looking for in body types similar to theirs, so they can show me what it is that they're looking for. And that tells me, number one, do they see themselves realistically, and do they see their outcomes in a realistic way? And that exercise has really helped improve the communication in terms of understanding what reasonable expectations are. The cost, patients need to understand the cost is not just the surgery, right? But it may be missed time from work, it may be missed time from family. If, God forbid, there's a complication of one form or another, can they afford to miss that additional time? Can they deal with the wound care that may come? Patients are, it's important to talk to them about these things as possibilities. Are they common? Blissfully no, but they're still possible. So I would encourage surgeons and doctors to have the complication, or have the complication conversation, have the conversation about, what would happen if, heaven forbid, there was a complication. Some psychiatric issues. Are you in a good frame of mind to have a surgery? Can you handle a complication if a complication happens? And are you doing it for the right reasons? Plastic surgeons have often been accused of being a psychiatrist with a scalpel, and we are fortunate to get a lot of patients who are trying to improve themselves and trying to feel better about themselves. But we also see patients who feel that by changing this or that part of them, that's going to get them the promotion, that's going to keep their spouse at home, that's going to insert whatever story you like. And the blunt reality is the only person that you should be doing this for is yourself, right? And so reasonable expectations, doing it for yourself in the best health you can be, all of these factors go into decreasing or limiting what might be considered a botched procedure, which in my opinion often has to do with the breakdown in communication between what a patient is saying they want and then what a surgeon is saying that the surgery itself can deliver. I hope that was helpful. Stay tuned for the next episode where we'll talk about some facility factors. Take care.